take a minute because it actually takes some time to get connected with LinkedIn and
Well, you're kind of a pro. You sound very calm.
it'll just take a minute or two to get. Oh, you know what? Maybe it didn't take. Hold on a second. Good day, everyone, and thank you so very much for joining the Charms MEDI-HELPZ Foundation and on this video discussion that we're having tonight. And tonight, our focus is on older Americans. And you might be like, when Sandra, older Americans, what do you mean older Americans? How old do you think older Americans are? Well, age is nothing but a number. So you're definitely going to be over the age of 25 to be considered an older American. But from there, you make the choice on whether or not you want to be considered an older American. But here's the key to tonight's discussion is this young lady that we have, Miss Kimber Westmore, who's going to be coming to us shortly, giving us some information on a very timely product. And once again, Charms MEDI-HELPZ Foundation, we are all about the information and about the resources. So what she's going to be introducing us to tonight is both informational and it's also a resource. It's not just a resource, even though this is older Americans, Mom, woo, go older Americans. This tool can be used for younger people. And it's important that we keep this in mind because a lot of our health conditions now that we thought, well, we would never, ever see them again. A lot of the health conditions that we're seeing now are attacking and impacting our younger people. So they're being put on medications. That a number of things that we, when we were growing, we were coming of age, it was like, oh, they said that's eradicated. We'll never hear about that again. Or they're coming up with these new diseases that we don't know about, but they are tied to medications. So we have to make sure that we let everyone know that whether you're young or old, this tool that she's going to be introducing to us is in fact a tool that can be used for younger people and older people, but it's extremely critical that we all know about it. So without further ado, I'm going to go ahead and introduce Miss Kimber Westmore. I'm going to let her tell us all about herself, and then we're going to go ahead and get into tonight's conversation. So Kimber, who are you?
Well, I am a young 65-year-old parent, grandparent, and daughter of a 91-year-old mother. And I work in fire life safety training. So my career is in emergency preparedness training. I am still fully in that career. I help people prepare for the unexpected, fire, earthquake, medical emergency thing, people that are in high-rise commercial properties. But my other part of my life is about keeping my parents safe, and that's why I created this this medication guide. And I don't know if you want me to show it now, but that's the sole reason that I think I'm here today. And I just had to do something to protect my parents and to improve to be prepared for emergencies.
So Ms. Kimber, if you can you tell us a little bit about the product that you developed, and can you also give us a little bit of background about why you developed that product?
Sure. I'm going to hold up a little show and tell here. This is a cardboard pill map. It's a medication guide that serves to communicate everything that a first responder would need, or a family member would need, or a person going to a doctor would need to communicate what medications they're on. And so the reason I created it, and I'll show you a little closer in a minute, but the reason I created it is because we experienced in our family alone multiple mismedications. Luckily, no one died. But when doctors are changing medications, pharmacies are providing a different color pill when you go to fill your prescriptions because the generic pill has changed from a blue pill to a white pill. All those changes create obstacles to your health. And it's very challenging for individuals to keep track of what what maybe your doctor or pharmacist thinks is just very straightforward. Um, I'm not in the medical profession. I have a daughter who's a nurse, and I have a brother who's a doctor. But I'm telling you, we all were overwhelmed with trying to manage medications for our parents. Um, it is the legend. Let's say, if you had a map, you have a legend that tells you what that means on the map. I like to say it's the only truth that it stays with the person. So there's never any confusion if you're supposed to take a pill um, in the morning and at night. That would be on here. If you're supposed to cut a pill in half and have only half the pill at lunch and half the pill at night, all of that is on this simple card. I don't really love the phrase simple stupid, but it is so simple. It's the opposite of every tech thing out there, every app. Because when there's an emergency, it's very hard to get to a phone and pull up an app and then share that with first responders or share it with your doctor. We are just amazed at the stories that we hear of people that just walk into their doctor and they've filled this out. You fill it out. It's not your pill box. It's the legend to your pill box. So you might have a pill box, which we recommend, where you've put your pills in for morning, noon, night. You've maybe filled that every week. But this tells you that you have 7 pills. You'd have 7 pills in your morning box. You'd have 2 pills in your noon. You'd have 3.5 in your night. And this has to match what's going on in your pill box. When you go to the doctor, you hand it to the doctor and you say, this is what I think you want me to take. And this is when I think you told me to take them. And in our own experience, what happened was we would go, my mom wasn't feeling great. She was losing energy. I take her to the doctor. We took our first iteration of PillMap to the doctor, and he said, why are you giving that whole pill? Taking that whole pill? You're supposed to be taking half of the pill. And so again, we realized, they think that we understand that when we pick it up from the pharmacy. We don't know, are we supposed to cut that in half? Because it's in small writing and it's written on a white sheet. And so we cut the pill in half and we put it in this window. So if I'm taking the pill, I know, okay, I'm supposed to take half a pill. If a caregiver is helping someone, the caregiver can say, okay, here's half a pill. When you go to the pharmacy, pharmacists love this. When you show up to the pharmacy with your pill map, when you're picking up your new prescription, because they can see if what you're taking and if there'd be any collision of medications. You might be taking a vitamin that you're not supposed to be taking with your stronger medicine. So again, this is the truth. This speaks for you. There's all your other emergency information on the back. Doctors, if you're taking any liquid medications, if you have any allergies, your emergency contacts, everything that someone would need if you couldn't speak for yourself at the moment or couldn't recall what the blue pill is or what the half pill is. It's all here. So, I mean, this has some coffee stains on it, and it's been around for 3 years now. When we have a change of pills, we just open this cavity and we take the other pill out and put a new pill in. We have an erasable pen, so you can erase. If there's a change of your medication, you just erase it. So you don't have to buy a new one every time your medication changes. We've tried, because we needed it for our own family and our own use, we learned fast that medications change all the time, that doctors aren't even up to speed sometimes on what you're supposed to be taking, because they look at the screen and there might be a medications you've been taken off of, but that stays on their screen. There's just so much we've learned along the way that makes us more confident that this will save lives, is saving lives, is making people healthier because they're taking their medications properly.
And I thank you so much for that. You know, whenever we come up, and I'm not going to say whenever we come up, but a lot of times when we come up with ideas, because it's something that has impacted us in some way, right? Negative or positive. And we learn and we're like, we don't want nobody else to go through that. So why don't we do something, right? And I give credit, because so many times we sit and we talk about, oh, well, they should have did this, or oh, they should have did that. When if you have the wherewithal and you know what will be helpful to people, stop talking and do it. Right? Get it on the market. Get it to somebody that you know can use it. You know, don't just stop and say, hey, this shouldn't be happening. We got to change this. I mean, we can't sit back and wait for things that we know need to be changed or that we know need to be out there. And you're so right. You know, a lot of times we go to the pharmacist, and unfortunately, when we go to the pharmacist now across the country, and this is going to bring up another question in reference to that, across the country, we have pharmacies that are closing, right?
Yes. Independent.
Right. I mean, it's not even so much the independents. We have Walgreens is closing a lot of their pharmacies. CVS, well, in the neighborhood I live in, CVS has just literally went through and just wiped it out. A lot of their pharmacies.
Yeah.
Walmart is the latest. Well, actually, Walmart just exited altogether out of the healthcare field. But it's like, do you have, like, is a pill map something that can be turned into a digital tool so that those people who are now using the mail orders can actually send that in and say, this is what I'm currently taking?
At this time, no, because we've tried to stay in the lane of this is for everyone in a family that has to do with this person and their doctor and their pharmacist. Within our family, we take a picture when something changes, and we take a picture of the front and send it out by text to every family member. And I assume you could take a picture, you know, same way I'm with Kaiser, and we take pictures of things and upload. What I did learn from a school of pharmacy here at USC is that medications, the systems, the computer systems that allow for the pharmacist to the doctors to put the prescriptions up into the computer system and attach it to the person. It's flawed for this one area where they can't pull pills, medications down, or it doesn't work because they don't know if they're going to be able to prescribe it again. So they leave it. So Kimber Westmore, I might have a medication I took 3 years ago, but if I had an emergency and I was taken to a hospital and they pulled up my name, they would still see that medication. And that happened with my mom. But my mom had her pill map, and the pharmacist from the hospital, because I wasn't at that hospital, my brother was, said, "Hey, I've got this thing in my hand, and it says that doesn't show metoprolol for your mom." But when I pull it up on the computer, there's metoprolol. And so I was able to say, that's because they took her off it 3 years ago. Oh, so this clarified that for them. And time is of the essence when there's any emergency, and especially a medical emergency. But it's the slower decline of people's health that's going on that we're not noticing, because no one knows someone's not taking their medications exactly how they're prescribed. The person is diligently trying to, do what they're supposed to do. They've been examined. They maybe been released from the hospital, and they've been given this protocol, but there's a huge gap in the communication and the understanding. And it does sound like a foreign language to someone like myself when you hear the medications, so you write the names out, you have the name, you have the dosage, you have when you're supposed to take it. And this is what every doctor that we've been to, every hospital, every emergency room, this is the game changer, because they actually can see the pill. They can look in the pill boxes and see. And this identifies what those pills are. Because a lot of people just grab their pill box if they have an emergency. Who knows what it is? Or they grab a bag of pills. Half of them are expired. And, I'm sure a lot of people that'll watch this have experienced in their own life in some way, whether their own medications or someone they love, the anxiety around it.
And you're so very, very true, especially when it comes down to our older Americans. A lot of them are savvy, very, very savvy, and very, very on their game. But then you have a lot of them that are not. Right? They're not. I mean, and not even, once again, it goes back to our earlier conversation in reference to young people even having a pill map and being able to use it if they're on medications. When you're sick, it's the worst time for you to be thinking about what you're taking. Right? It's the worst time for you to be thinking about, oh, let me grab the right medication. You're just going to grab whatever medicine is there with you. And unfortunately, it happens too often where people are taking things that they shouldn't be taking and putting their own selves at risk, but they don't have anything. The pill map is a tool that they can have and they can use, and they can say, okay, well, this is what this is what's going on with me as far as my medications go.
Exactly.
So it's truly something that, we need to make sure that we have. I do have a question for you in reference to the pill map. Now, on the pill map, when you write it out, is there also a place where you could put like a generic name, the generic name of the medicine? So say you have a name brand and there's a generic equivalent. Is there a place where you can put both of them?
Yes. So people use it different ways, but what we recommend is that if you're taking I'm going to say Pradaxa, that's a blood thinner for people that are on blood thinner, and it's called Pradaxa, then you'd write the name Pradaxa, and then underneath you write blood thinner. So we know what it is, and also there's a place for the dosage. But say the name Pradaxa changes because you're getting the generic, we provide an erasable pen. So if you fill this out with the pen that we give you, you can also erase it with the pen we give you, and you can make it more. You can define whatever you want. You could say the new name and then write under that it's Pradaxa, and then so we fill in underneath if it's for heart, if it's a PRN, if it's just when needed. There is room for that. and we recommend it. We've just learned so much about, I don't care how old you are, if you take more than, say, 5 pills, it's just smart. It's smart to have, even if you don't do this, take a piece of paper, tape your pills to it. That's how we started, with some Scotch tape, one of each. Write all that information down and have it so that it can speak for you.
And you're so true about what you just said about, about writing it down. I've developed a personal health and family journal. I want people to use it. However, I don't care what you use. I just want you to put the information down.
Exactly.
I want you to show up at a doctor's office or at the hospital. I want you to know what your history is. I recommend you get it in a nice little, nice journal or nice book so that it looks, the doctor's not trying to sit there and figure it out. He could see it or she could see it, right? And so they're not trying to figure all of this stuff out. It helps you. It so helps the patient. And the fact that the doctor knows, the doctor's not second guessing it. We sometimes put a lot of pressure on our medical professionals when we shouldn't, right? They're not minded. They have a whole slew of people that they have to treat. And, gone are the days when medicine, when the hospital and healthcare, the doctors had all the time in the world to spend with their patients. That's not happening now. And so we know it's not happening. So what do? Do we sit back and complain? Or do we take proactive steps, such as having a pill map, having a journal, having a binder, having anything to actually help us when we show up at that doctor's office or when we show up at the hospital? Or do we take the chance, like what you were saying earlier, do we take the chance of being misdiagnosed because we don't have the information? Or because we're giving wrong information with the pill map, or because we're giving wrong medicine that we shouldn't be on, because the doctor doesn't know all the other medicines that we're taking. He doesn't know that we're taking 10 medications, and the medication he get ready and it kind of interferes with the medication that we're already taking. He or she is not a mind reader. We've got to right?
They're not, he's not or she's not a mind reader. And when you walk in with something that defines it, I'm telling you, we get calls from doctors, we get calls from the intake person, the first nurse that has to take the information before they see the doctor. This, first of all, frees up more time to actually talk to the doctor, because this is, cut and dry. This is just so straightforward.
Right.
And oftentimes I would assume they could maybe cut down. There's a lot of deprescribing. They could look at this and say, you're taking this, but that is kind of the same thing. So why are you taking both? It just gives them that opportunity. We put our supplements in too. Vitamin C, we put it in that too. What else? Vitamin D, we put it in because we want the doctor to know
the full picture.
We're also taking those.
Right.
Yeah.
Not only putting it down that you're taking the vitamin C and vitamin D, but also what time of day are you taking those vitamins? Because you could take all the supplements in the world, all the medication in the world, but if you are not taking it at the right time of day, you are messing yourself up more. So when you write it down, say, I'm taking this during the daytime. So when the doctor or the pharmacist looks at it, right, they can tell you, look, okay, we know you need this, but perhaps you need to take this in the morning or in the afternoon or in the evening versus when you're taking it. So, be mindful of the fact that you're taking the supplements, you're taking the vitamins, whatever medications you're taking, but be truthful and say, this is when I'm taking this, right?
Yeah, that's really good point.
I have a nurse that's on my board, Nurse Carolyn, that's on my board. And, when we do videos or we're talking, she can't stress it enough. So, and because she's not here today, I'm going to stress it for her. is be truthful with your doctors. Don't,
Yes.
because they could figure it out, but you don't want them to figure out the wrong thing. They can figure it out, but be truthful with them. Let them know, hey, I'm taking vitamin C. I take it twice a day. I take it in the morning or not take it at bed. I don't take it every day though. Sometimes I skip. Like, be honest and truthful. The only
Yeah.
person that you're hurting in all of this is you, the patient, right?
Right.
Um, the next question I did want to ask you, and we briefly talked about this a little, but who should have a pill map? Like, is it just, for the patient, or is this, who in the patient or that's with the patient should have access to that pill map?
Well, we've learned from just people buying it. There's someone that buys it from us and sells it on Amazon. We don't sell it on Amazon, but we get the reports back, the reviews, and it seems to be being used. It's being used in all 50 states, but it's being used in the reviews. It's being used for children that are on multiple medications. So the parents are buying that, right? And they're sharing that with whoever they need to. It's being used by husbands and wives. And so this kind of surprised us, but we've heard this comment multiple times. When you have a very independent spouse and you're both doing your living life and you know that you're fully capable of managing your own medications, you don't have any idea what your spouse is taking. They might be on the counter. If one lady told us she just puts them in her jewelry box and kind of knows, and she goes around and takes one here, one there, one there. But they've never had any issues. But say there's an issue and you're the first responder or the doctor is asking you, what does your husband or wife or partner take? And you don't have something like this to hand over, then, like, I'd feel very bad if, someone I was so close to, if I overlook that. So again, it doesn't have to be a pill map. We created pill map, just me and my kids, because there was nothing that was solving that issue for us. Nothing that was protecting my parents. Nothing that was simplifying what should be the last thing you have to worry about when you have to do all these other things to stay well and live life. This is it just puts it so you sleep at night, whether it's your information or it's someone else's, when if you needed it, you'd have it.
And that's so true. When you say husbands and wives, right? They're living their independent lives, and we have our setup, and so that's how we are. But COVID came, and a lot of us weren't prepared. We had no idea. We couldn't go into the hospital or into the doctor's office with our loved ones because of the rules, right? So
Right.
what happened when they went in there? Could we have done, had a pill map ready? And so when we had to drop them off at the hospital door, we could have said, hey, take this with you, right?
Right. Yeah.
So, the pandemic.
In any situation, and I've been in them all because I have two parents. I'd lost my father 2 years ago, and a mother-in-law. All three were fully dependent on us protecting them after being all totally independent. It hit us in 3 months. My mom broke her neck. My dad collapsed with a heart situation, and my mother-in-law, 4th stage metastatic cancer, all at once. And so our family was just, trying to keep them alive when they got to come home from the hospital. And we're waiting for that first nurse to come and reconcile the medications. We had a bag of pills. We're supposed to manage it. It's so overwhelming, especially when you're emotional. But when a first responder comes and you hand this to them, we don't even say we made it, but we love, even my mom loves when she's had to have a 911 call, when this gets handed to them, because she knows that they're gonna say something, and we're just like, okay. I've posted a couple pictures of first responders' responses to it.
Yeah, I mean, and that's helpful to know. Like you said, we need to, right? They were so independent that and no one really pays attention to things until it happens and it's on us, and we have to stop that retroactive response to stuff, and we need to be preparing proactively to actually work with and have things on hand that will help us, and back to COVID, we didn't know. And it wasn't the last time that we will see an epidemic. So what are we gonna do when it happens again? Are we
Right.
gonna be unprepared when we have all these tools out here?
I
All
know.
this
Yeah. It
information.
is common. It's human nature. I work in emergency response training, right?
Mhm.
It's human nature. I would say that there's probably 90% of the people that we work with that think nothing will ever happen in their own life, even though they've already experienced things or seen it on the news a million times. That's just human nature, I think. So, what I like to say is, what about simplifying your life? Forget about, I'm going to have this big emergency. Something horrible is going to happen. We're going to have an epidemic. Just simplify your life by filling something like this out and having it when you go to the doctor, when you go to the pharmacy, and when you fill your pill boxes. Have this sitting there so oh, I'm supposed to put 7 pills in my morning box. I'm supposed to do this. Just simplify that part of your life. That speaks to me, because life is so, we're pulled in a million directions. This gives you more time to love your loved ones, to, have a better sleep, just live a simpler, better process. But I just don't think people, it's just human nature. I don't know.
And you know what happens, and you're right, it is human nature, but what happens is that we need to hear things repeatedly, right? We need to, like, we're saying this today and then we don't hear it again, and then it loses our thought and it loses our track of minds, because we like, well, I heard about that once, but then it
Yeah,
just slips because we don't hear about it all the time, which is why when you hear it, is what you need to be doing is taking note of it, writing it down, taking note of it, and going ahead and doing those things that you need to do to be being, once again, be proactive.
right.
And so I thank you for that. So it's like everyone needs to, as far as in the patient community, I would think, a caregiver would also need to have this, know
Yes.
how it works, know what's going on. If you have a child and that child goes to a babysitter, make sure that babysitter has one. It's the summer's getting ready to come upon us. Kids will be in camps. Make sure that if your child is on medication, you have a pill map and you're taking it to the camp, director or counselor, and saying, hey, my child takes this medicine. This is what it looks like. Can you please make sure they're getting the correct medication? So once
Exactly.
again, while the building of it and the development of it was developed for an older American, it's helpful for all, not just Americans, but for all of us to know that the pill map exists and actually
Hmm.
how to get it. I do want to backtrack for a second, and I do want to actually mention this. You
Okay.
mentioned earlier about the medication and how, like, like, medication stays on the patient's chart, right? The patient stops taking it 3 years ago. It
Yeah.
stays in their chart. I just want to encourage everyone, no matter when you're looking at this, please take the time to look at your medical chart. See what medications are in there that shouldn't be in there, and make sure you're making contact with your provider, your medical provider, and saying, hey, you got all this medicine in here and I'm not taking it. I remember maybe about 4 or 5 years ago, my the managed care, not wasn't the managed care, it was actually the healthcare system that my medical doctor belongs to, actually had a pharmacist on staff. Now I've been with
Hmm.
this medical system a good 5 to 10 years, and never once have been approached by a pharmacist at my visit to go over my medications with me. And I was
Mm.
like, okay, well, this must be new. And she's like, no, we've always been here. I'm like, well, they must have just started pushing this. So they have a pharmacist that will go through your medications with you, take off the stuff that you need to take, have taken out of your chart, take it out of there. If it's stuff that you do as needed, they know how to go in there and chart it like that. But
Right.
please make sure you're paying attention to the medications you're taking. If you're taking care of an elderly person, especially, please take note, have their medical records pulled, see
Mm-hmm.
what's in there. If their medications are in there that they are no longer taking, or if they've moved from taking it maybe once every day or twice every day to as needed, make sure you are making contact with that medical provider's office so that they can make sure that your loved one is not given medication that they should not be given. If you don't do it, it's on you because you've been told. Please
Excellent.
make sure you're taking a look at what medicines are in your chart. Please make sure you're making contact with the medical provider and saying, hey, can you change this or can you do that? As a matter of fact, I kid you not, there was maybe about 3 or 4 medications that I was taking. They were duplications. They were calling them something different. One
Right.
doctor had put it in as the brand name. Another doctor had put in the same medication in, but only they called it the generic name. Another doctor did the same thing, only called it another generic name. I was like, ain't that the same medicine? Like, it's that
Yeah.
same medicine, right? I
Yeah.
had them explain to me what the medicine was, and I was like, well, isn't that the same medicine? And they was like, yeah. And then they caught it. Then they was like, oh, we see what they did. I'm like, yeah,
Wow.
I can tell with you what they did just based on what you're telling me. So just everyone, no matter when you're looking at this, just pretty please play close attention to your medication list, because that's how misdiagnoses happen. That's how medication errors happen. That's sometimes how patient safety issues happen as well, is that you're not paying close attention to what's being placed in your medical record.
Right.
Um,
And I have something to add to that that you just made me think about. A lot of times now, the pharmacies and the major, I don't know, health providers are sending you an update that your medications are running low. They're due um, to be reordered and they'll ship them to you. So that's amazing because how easy, you don't have to go to the pharmacy. But again, if you don't have something, a cross reference, when you, I get this with my mom's because hers comes to my phone. It'll say, it's time to refill this. And again, occasionally it's been, no, 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 she's not taking that anymore. So I'm not going to click refill, right?
right.
So I know that because I can look at this. And then say I make the mistake and I say, okay, refill. And it comes to her house. And then I'm filling her pill box. I'll know, oh, yeah, I'm not supposed to give her that. The pharmacy is so far removed from your personal health journey that they are not going to know that you're making a mistake with your medications. So I think it's most important now that there is the telehealth and there's the medications being delivered to the home where there can be even more errors and more hospital. There's a huge percentage of hospital rehospitalizations solely because someone was not taking their medications correctly. They're sent home from the hospital. They've been there for a while. They're healthy enough to get home. They get cozy at home and they're back in a week because the medications they were prescribed are not being taken properly.
And you know what? And you're so right about that. And it's unfortunate. And I so encourage, I so encourage this and I push this as much as I can, that we have to have a better discharge plan, right? When
Yes.
you discharge
Yes.
a patient, especially an older patient from the hospital, let's put in something that, we'll make a call to them to see how they're doing, to see if they have any questions. Call them. I mean, if you don't call them the next day, call them, at least 3 times within that first month of them going home, so that you can make sure that they're actually are taking their medications. They don't have any problems. They're not having any side effects or anything else. Discharging a patient from the hospital and saying, "Woo, you on your own now. You ain't under our care. You're on your
That's
own."
how it feels.
That's exactly how it feels, and it's
Yeah.
a shame that it feels like that. But we've got to do better about making sure that we know that when we send a patient home from the hospital, that we're just not sending them home and wishing them, wishing them well, right?
Yeah.
And thank you, Jules, for commenting on what we're talking about here. We need more patients to understand that. We need the healthcare system to understand that. Stop sending patients home and saying, "Woo, you know what? Go away at home." And the thing, here's the thing, right? Here's the kicker, Kimber. The patient goes home. Once again, they get readmitted. That's a huge fine for the
That's
hospital.
fine. Right.
It's
It
a
is.
huge fine for the hospital. It's a huge no for CMS, because they're going to start losing their stars that they need to stay in business. They're going to start losing those stars. It's going to be really, really hard, for the hospitals, especially with them now saying they're struggling financially. Well,
Right.
here's a way for you to stop struggling financially.
Right.
Think about discharging a patient home with a discharge planner and someone else. Call a clerk, if call a medical assistant. Give them that job of calling the patient and saying, "Hey, we are at home. Do you need help? Are you taking your medicines correctly? Do we need to send someone out to the house to check on you?" If they need help of a clinical nature, send them on to the clinical team and say, "This patient needs help." Let's stop recycling patients in and out the hospital because
That's yeah.
we're home without anything. And
Well,
Julie
on
said,
the
hold
on
on,
the
Julie.
heels of that, really fast is there local hospital here. It was pre-COVID. They defined their highest risk population that gets discharged and typically might come back due to medication errors. And they bought 1,700 pill maps. They called it the pill map pilot. And they sent these home with the discharge, and they had someone come to the house and go over this, help them fill it out. And then they tested how many were people coming back because they were mismedicated. So we got 1,300 in the results. They used 3 of their highest, most preferred home health providers that would go for that first visit within 24 and 48 hours. And it was changing things. And then COVID hit. So it was kind of a scientific study they were doing to see if they could lower those numbers because they were getting docked for that reason. So we were so encouraged by that, and felt like that is the right protocol. Don't let that person or that family or the caregiver fall into that space of not knowing how to protect the person.
Right.
Give them tools.
And Jewel is saying here, they don't know how to help or care to help. And I want to add something to this, is that a lot of times it's not so much that the people that are working don't want to help, but the rules and the policies and procedures on how they can help without getting written up is ridiculous, right? And she's also saying she had spine surgery and could get home health care. It's ridiculous. And it needs to, things like that we need to have.
Ridiculous. Yes.
It's truly ridiculous. You need to be able to if you have home health care, someone even calling on the phone and saying, hey, how's it going? You would know, right? Let's stop
Right.
this, all these fines that are going through. For this would be a prime time for them to pick up another pill map, study and survey and see, is it
Right.
really, does
Yeah.
it help? And if it helps, making sure that it gets into the hands of more hospitals and more outpatient sites, more wherever we see a larger number of patients that are being recycled in and out of the healthcare system. Uh,
Yes.
I do want to ask you, where can PillMap be purchased? And I know you said Amazon, but
Well,
what else can PillMap be purchased from?
so we have a website and it's pillmap.com. And that website would show you so much more. You get to see how it's being used, um, and you'd be able to purchase the pill map. It's less expensive if you buy it on the website, but of course, Amazon, you get it the next day. You don't pay shipping, so it's just how fast you need it. Um, Ours would probably be in your hands within like maybe 5 days. And we offer a discount. We're offering a discount because we really want people to just be safe. We're a family that's created this. It's made locally by a packaging company. We we put them together as a family. Our heart is really that we want to change people's experience. We don't want them to go through what we went through. And then when we read we love when people will send us emails or make a review and say how they used it. Like we have our whole family smiles. We pass around and, it's our pleasure. And we're certainly not, we don't have you know, we're not a big business. We're a family owned business, but it's being used in every state now.
Well, and it has to make you feel good because once again, we get in a mood of talking about what changes need to be happening, but to actually make those changes and to actually get that positive feedback, like, oh, this has truly helped me, and this helped in this way.
Yeah,
It's got to make you. I mean, that's a feel good,
it's the
warm and
best.
fuzzy. Look, a warm and fuzzy and cozy feeling,
Yeah,
right? That's
it's
what
the best.
it is.
Yeah.
Now,
Um,
go ahead.
no, I just thankful that you get it, and I'm sure anyone that's tuning in or will be looking at it later, we've just all have been in either ourselves or have extended family or friends that would have needed something like that. It might be too late, but you know, it's definitely something that will change people's experience.
And I do want to ask you also. Now they go to that has any thought because I'm giving an answer question and I don't know if you've thought about this or not, but
Okay.
has it been brought up where people can actually use like their FSA card or their insurance cards to actually purchase pill map for themselves?
It falls in the same category as a pill box. So we have bought it. We have personally, and we haven't had anyone say that they haven't been able to be reimbursed on their or use their card.
Okay.
But we can't speak for everyone because there's not an actual certificate that says, there's categories and it's basically a medication guide. So it falls in with pill boxes that are certainly on the list.
Yeah, because I would think that if you have an employer commercial insurance and it's a FSA
Yeah.
benefit, and you can actually say, "Hey, doc, write me an authorization for this if you're on a HMO or a medical necessity for this, so that I can get this and I don't have to pay for it, or my FSA can reimburse me." And Jewel is asking, what is the name? The name of the map that she's come out with is pill map. And I'm going to go
Just
over
one word, pill map,
right,
and it's a
one word,
medication guide.
right. I'm going to go over this with you, but I would suggest that if you have a commercial insurance and you want to get a pill map, call that insurance or call that FSA and ask them, say, hey, would you cover this? If so, what do I need to get this covered? The same thing with your insurance. Say, hey, if I pay out of pocket for this, will I be able to get it reimbursed? I'm not sure how Medicare or Medicaid will cover that. And Kimber will actually talk a little bit further in reference to this, because there's some projects that I'm working on as far as public health in the area where I live, and I would love to actually be able to put this on the list of items that we should be able to get grants for, to be able to get to people, because
many have been purchased, many bulk pill maps have been purchased through grants where that grant is to help seniors or lower medication errors or fall prevention.
Right.
All of these have
right. And now, and I will actually double back with you and check with you and just get some information, some logistics out, because I'm coming up with a list now of supplies and everything that patients need that we don't have in this area to try to get this to them. And Jewel is saying, I probably need that. Jewel, I think you do need this. Before we close out for the evening, I'm going to go over, and if you missed this, when you see my you can either go to my YouTube, you can go to our website. Once again, under community events, this will be placed under community events. Our YouTube, LinkedIn will actually also have it. It'll also be up on Facebook. Scrolling across the bottom of the screen, you'll see she actually has given the name of the product, her website, which is pillmap.com, her personal email address at pillmap. So if you get it and you find that it's very, very useful for you, please go ahead and send her, comments saying, hey, this product. Even if you don't, right? If you like, what, there's some changes they need to do to this. Send them to her, right?
Yes.
We don't, they're open to making changes that they can make if they know that those changes are being requested, right? So if you get in and you're like, well, you know what, I like this, but yeah, really, I don't really need this. Then we could, they could fix it, right? Or they can make it so that it is something that's available for use on the pill map. So please do that. Also, if you're purchasing this item off of her website and you use CHLMS, which is CHLMS 15, you get a 15% off discount when you purchase this product.
So it'll come right off, but I haven't put that in yet. Okay. So I would say by the end of the night of 5/15, it's the 15th, that will be up. So
so this is the thing. If you do use it, if you do get it and you do use it, please send me an email, whether it's an email or message of some type saying, hey, Sandra, I brought the pill map because I saw Kimber on the video. I brought it and it's of some great use. Please let me know that as well. Not so much so that I could take credit for having Kimber here, but so that I could pass the information and I could continue to pass the information along so that more people have access to getting the pill map. And Kimber, before we go, with that beautiful infectious smile that you have, you're holding it in all night. Go ahead and just give us like and for everyone that's here, if you had a comment and I didn't see it, please know that it's not from the heart. If you have a comment and you want to make a comment but haven't, please send me a comment either through Facebook, LinkedIn, send it to my email. Just, go ahead and send it and I'll receive it so that I can know that and I can pass this comments on to Kimber. But Kimber, with that beautiful smile, before we
Thank
close
you.
out.
I just want to say thank you. And it's such a pleasure to meet you and whoever listens to this. Just know that we're just on this life journey together, and anything that any of us can do to help each other improve our lives, our health, and our families, and just make things brighter in some dark times. Um, I just be honored to be on that journey with you.
Thank you so much. And everyone that's watching, please continue to enjoy your evening, your day, whatever you're doing, please continue to enjoy. And that will be it for today. Thank you.